So these are my disclosures. I keep in mind that I helped develop a product in this space along with Charlie, JV, and Andrew Cooper, so keep that in mind. Contrary to what the guys from Belgium, what attracted me to the anterior approach was to use fluoroscopy in surgery and not have a surprise in the recovery room. So that's what I learned posterior, and that's one of the main reasons why I moved to the anterior approach. And, we demonstrated early on that you can get pretty accurate with this. We kind of peaked at about 92%, both combined aneurysm and inclination with just plain fluoroscopy, regardless of the BMI. So you can get pretty accurate even with high BMI patients. And now there's been an explosion of technology. I mean, now you're not just using fluoroscopy. You can use fluoroscopy on steroids. You can add value to that with different technologies that are out there in the market. And, and the question still remains, should we alter the cup position in patients with a stiff spine? There's a lot of debate on that. We know that these patients are at an increased risk of instability. And I bet you that if I ask the audience if anybody has a dislocation problem, you all will say no, but the AJR data shows that 20% of revisions in this country are done for instability. And early revisions is the number 2 cause of revisions, about 27%. So it's not insignificant. JV published a couple of papers on this, and about 50% of the cups on revisions were malpositions in his series. And when he specifically looked at unstable hips, what he found was that if you didn't use some sort of spine hip protocol, about 70% of the cups you would think they're in the right position when in fact they're not. So, I helped develop Cuptomize with Charlie and another group of guys, and, it's a very simple